office, and I want to welcome you to our monthly Opioid Response Summit webinar. Today's topic is recovery community centers and their role in our work here in Maine. And we have a terrific faculty of led by Michael Freysinger, our social services recovery manager at the Office of Behavioral Health, who will moderate today. We have Bob Fickett from the BAN, the Bangor Area Recovery Network. The BAN in Brewer is the oldest recovery community center we have in the state. And we have Beth Alteri from Inspire Recovery Center, operated by Healthy Acadia in Ellsworth. The next webinar will be on December 2nd. We haven't picked a topic yet. We'll do that after Tuesday's election when we see, how much planning we have to do, and we will announce that probably by the following week. I'm using this morning's webinar to announce our new opioid response project manager, although the title is going to be a little bit different. But I think most of you know that Josh Miller, who succeeded Roland Robinson in that position at the Office of Behavioral Health, and that person works very closely with me. Josh has taken another position. Still be able to be in Maine, and he'll be at a place with the border, Northern Border Regional Commission, where we'll be able to see Josh and interact with him from time to time. We're very appreciative of all his good work. But we're also excited that without having a gap period, that we had an internal candidate, Madison Barassa, who is and will continue to be the SUD program manager at the Office of Behavioral Health. And she's going to assume all the responsibilities of the opioid response project manager. So while the title won't change, the responsibilities will. And we're very excited that Madison's going to do that. She's had some positions with the state. She's had this current position for a while at the Office of Behavioral Health. And rather than me give an introduction to her, I've asked her to be with us this morning, which she is, and she's going to introduce herself and say whatever she'd like about how excited she is about taking this on. Madison?
Thanks, Gordon. Thanks for the introduction. Hi, everyone. Beautiful day here, November, Friday morning in Maine. It's nice to be here. I am Madison Barassa. I'm the SUD program manager for the Office of Behavioral Health. I have been with the department for about 5 years, the last 2.5 with the Office of Behavioral Health as the SUD program manager, overseeing most of the office-based MAT programs, the naloxone distribution programs, and some specialty pilot programs. So I'm really excited for the opportunity to step into this role, be able to work with Gordon, work with you all that are attending today, and to meet you all in person at some point. So really excited for this opportunity and really excited to be here to see this presentation. I think you all will really enjoy it. So happy to be here. Thank you so much.
Well, welcome aboard, Madison. You will see Madison and I around the state a number of places, and really excited about her taking this on. We don't have a lot of housekeeping today. I don't think we're doing CME, as I recall, today. So if you have any questions, you can put them in the question and answer box. You can chat amongst yourselves. I see already you're putting in your titles and addresses, which I appreciate. I think the only thing I'd say remaining to be said by me is that the recovery community centers have been a really important, I think, success of our work the past nearly 4 years. We now have 17 that are operating in the state today. And we have 4 more that really are about to open, or we expect to be contracting with by the end of the year. That will leave only 1 county really without one, and we're going to do everything we can to be sure that Somerset County does get a recovery center. So we think there's a lot of work that can be done in a recovery center. We think it helps to break down stigma. It helps to have a center of activity for meetings. And I'm pleased to say I've been to all of them, although a couple have moved recently that I haven't been to the new sites. And we've also been able to get Governor Mills to drop in on some of the centers. So without further delay, I'm going to introduce Michael Freysinger. Michael's been with the Office of Behavioral Health for, I'm sure it's been more than a year. He will perhaps tell us how long, and he's been a great partner in this work. And Michael, take it away, and perhaps I'll come back in to just close out things in about 55 minutes or so. Thanks for doing this.
Thank you, Gordon. Thank you for the introduction. I've been with the office for almost 2 years. It'll be 2 years in January. And in my role as the recovery manager, I have the pleasure of working almost exclusively with peer services on both the SUD and mental health side. I oversee the contracts for the recovery community centers. And in that role, I support the contracting process. I help, when I can, support the operations, best practices. I receive the center reporting and help support creative initiatives at the centers. And I really appreciated the term you used, Gordon, to describe the role of the recovery community centers as being one of the more successful initiatives across the state and really across the country. Community recovery centers have been a really key component in addressing addiction on numerous levels. In thinking about activity, I've been preparing some statistics from center reporting, and I'd like to share those before asking Bob and Beth Alteri to start with the presentation on their centers, and then we'll have a little dialogue. And bear in mind as I share out some of these numbers that I'm still waiting for just a few centers to report in. But looking back over the time period from October 2021 through September 2022, we have served at community recovery centers more than 13,000 unique individuals. We are averaging daily visits. North of 175 individuals across the state are visiting a recovery community center every day. Recovery community centers have offered almost 6,500 groups or activities in that time frame. More than 2,500 individuals have received recovery coaching services at recovery community centers in that time frame. And group attendance, and this is a combination of online group attendance and in person, was just north of 70,000 individuals. And the total duplicated visitors across the recovery community centers, and this is separate from the groups, and this is from the sign-in sheet reporting, was 57,135 individuals visited a recovery community center in that year. And that's just really incredible. And I think it serves to the significant role that recovery community centers play across the state. And once I get the last couple of centers reports, and so please know those numbers are going to increase a little bit once I get those last couple of reports, and then we'll make those numbers public for folks. But I just wanted to share those to sort of frame up just how busy recovery community centers have been over the last year. And so without further ado, we'll hear briefly from Rob about the barn, and then Tracy and Beth about the Inspire centers, and then we'll have a couple of questions to frame up our time together today. So Rob, would you like to share a little bit about the barn.
Sure. Thank you so much, Mike, for all the hard work you're doing, as well as Madison and Gordon. You've been such a great support to the work we do here and being able to elevate that. And of course, thank you to AdCare for, helping us put this on. So, I think we're going to, as Mike said, kind of have a bit of a conversation develop with some questions. But I'm briefly going to kind of go over really what the barn is and what we do. We are a recovery community organization or a recovery community center. We don't offer, any clinical or professional services. Everything is peer-based and peer-led. So the first thing I always say that we do is we provide a space. I often frame it as saying, we provide a home for our recovering community and community building for our recovery community. So first and foremost, the barn is a safe space that people who are sustaining or looking to enter into recovery can come to find community and find supports. We also do some things here, aside from just offer the space. One of those things that, Mike mentioned is we have a large offering at the barn. It's over 120 a month of peer support groups, mutual aid meetings and recovery support meetings that people can access to find support from their peers to get some guidance on their journey. We also engage in a lot of pro-social activities. That's a fancy way of saying helping people to have fun, so we have dances, game nights, movie nights, barbecues, holiday dinners, activities for the kids. We just had a great trunk or treat for Halloween where the community came in and offered a really good venue for kids to come and get some great candy. So we do that pro-social activities, very important, more important, I think, than people recognize sometimes, that we learn how to have fun and make connections with each other and socialize with each other in recovery. So another, some other offerings that we have, aside from, those peer-based support meetings, mutual aid meetings, we'll also periodically offer training, education around recovery, and workshops, that feed up to somebody's success and somebody's personal development and recovery. We also have really kind of some like what we call direct service offerings. Mainly that's recovery coaching and telephone recovery support. Mike also mentioned those. We have a great team of both volunteer recovery coaches and paid intern coaches who, if you don't know what recovery coaching is, it's really a peer mentoring model. So somebody with lived experience is able to walk with you in your journey and what you see that you need to support your recovery. It's all strength-based, self-directed. We don't tell anybody what they need to do, but explore what it is they really feel like they need to be successful in their recovery and help to broker to them the resources that they would need, whether that, because recovery is a holistic thing. We approach it holistically in recovery coaching. So we have to look at housing, gainful employment, access to food and healthcare, mental health services. It's really a full wraparound of what the person needs to be well and to move forward. And then telephone recovery service, which I mentioned, is very similar, but what we call a brief interaction. So it's really about touching bases with somebody by phone, asking them how their recovery is going, what they might need to support it, what they've been doing to support it, and what kind of resources we could get them to further their journey or to better support their recovery. Another important element, that I say what we do is here at the center, we act as, advocates, both advocates for the individual, but also, advocates for the community at large, making sure that we're involved in community partnerships and initiatives, that we're helping to advocate for good legislation and good policy making that's conducive to people being able to access treatment and recovery services. Hi, Pat Kimball. Sorry, she made a comment in there. So, yeah, so, education and advocacy is huge. And I think that something that some people don't always realize right off the bat is that everything we do feeds up to reducing stigma, making recovery visible to the community. That's a very important piece of advocacy, is showing that people can recover and that it's possible for everybody. It breaks down that stigma. It also helps to advocate for those individuals and for our community. So we're very much are about making recovery visible and just showing people what it looks like. I think that when I talk about the barn, one of the things that I really like to stress is the community building piece. It's so essential to somebody's recovery. That they have social interactions, that they have other people in their lives and supports. Connection is vital, to moving forward with your recovery, because in, an active use and substance use disorder, isolation and disconnection and disassociation is so prevalent in that, that in order to kind of turn that piece, the most amazing thing that I see happen here is when volunteers, or patrons start getting involved, and you see them start to make those vital connections with their fellow volunteers or the staff or the other patrons. And they kind of come out of their shell and they start to become a part of something. And, one of the most important pieces, I think, to that community building is we really try to uphold the participatory process here. And really what that means is we give ownership to our patrons, to our volunteers, to everybody that comes in here. We get their input. We find out whether we don't build what they think they need and then offer it to them. We ask them what they would like to see and what they need. Volunteers and patrons all the time come up with ideas for new programs or groups or activities that we can do. And we help to make that happen for them. And that's really the participatory process, is somebody who comes in here has ownership when they can say, I helped start that group, or it was my idea to start doing that activity, or I painted that mural on that wall. They really feel a part of something. And that it does so much for somebody's self-esteem and their self-worth to be a part of that. So I think that that's really essential.
Thank you so much, Rob. Really appreciate it. And based on the comments, it sounds like a lot of folks know the great work of the barn. Tracy and Beth, would you mind sharing for a couple of minutes about the Inspire Center and what it is y'all do there?
All right, so we opened just about a year ago into this, we moved into the building a couple of years ago, and we always thought it looked like the perfect space for a recovery center, and we got the opportunity to do that last year. I think it's something that was, very needed in Hancock County, in Ellsworth. We offer a safe place for people that are in recovery, contemplating recovery. We just want people to feel welcome and to be able to connect with others, in recovery. I know in the very beginning, we were waiting for people to come in the door, and worried about how we'd get them in the door. And, this year you don't even have time to think about who's coming in the door because, you forget that you worried about that. So yeah, we're just, we offer there's NA, there's Smart Recovery, which are very well attended. We have parenting classes, parenting support groups. We have Tai Chi. We used to have something like mind body training. What else do we have? We've started a Smart for Teens. So just lots of, mutual support groups for people. We have games like Fun Friday, they have games, we have what's that table called?
We have a ping pong table. And we have cornhole.
So really just, a place for people to connect with
Mhm.
others and be safe. What else do you
Yeah.
want to add?
I think something that's really important as a role for community centers is to help people have fun. Like, yes, we're here to offer resources and activities and support meetings, but also we hear on a regular basis from people, I haven't laughed this hard sober in a really long time. And we have fun. Sometimes we're hula hooping, sometimes we're singing karaoke, sometimes we're playing cribbage, making TikTok videos. And we love what we do, and we love the people that we work with, and that makes it a fun environment. And I think that that's something that's so important for a recovery center, because recovery is heavy. It's a heavy topic. It's a hard topic. And sometimes it's really overwhelming. So being able to go into a place where you're comfortable and you're supported, but you can also be yourself and let down your hair, and you can giggle and just have a good time while working on yourself and being safe is so important. And I think that's one of my favorite parts about being a part of a recovery center.
And I do have to say, we have 11 staff members, including we have MRC interns, and everybody here loves what they do, and are so supportive of everybody that we serve in the center.
And in fact, we also have community partners who want to come hang with us. We've had so many people who are like, do you have any extra space that I can put my office so I can be here all the time? And so we love that too. Come visit.
Yeah, they meet, they meet here with people. It just gives, the opportunity for more people to see and hear about it. And again, I think connection.
I love that, and I love that that quote about I've never laughed so hard sober before, and based on some of the comments that definitely resonated with some folks in the audience today. And I continue to be impressed by your ability and the ability of other centers to draw people in. And I'm wondering if we can talk a little bit more about that and dive a little deeper into that, because none of the recovery work can happen unless you get folks through the door, right? And so, Beth and Tracy, if you can start, again, relatively new center, grand opening September 2021. And I wonder, in those couple of months before you opened, during the planning, and in some of those early months of operation, what came up as most important for you in terms of engagement? And then how are you able to operationalize that so successfully?
So I think one of the biggest things we, talked about, we wanted it to feel, comfortable, welcoming. We put a lot into the decorating, the paint,
choices,
the furniture, just the space, obviously, just put a lot into that. And then just, we already worked with recoveries, before we became a center. So, making sure everybody knew about it and trying to plan things that would draw people in. There were certainly days we, had more DMV customers. We used to be a DMV than we did, other people coming in the door. We wanted it to feel homey, just so really just making people feel welcome when they came in the door, greeting them. We all are right there when they come in. Yeah.
I'm that person that I like to feed everybody. So as soon as someone comes in through the door, even if they're a DMV customer, I'm like, we have coffee, we have snacks. And we have had, so like Tracy mentioned, our building is where the Department of Motor Vehicles used to be housed, and now it's right next door. So we are at the point where we definitely see a lot more people in recovery than we do people who come for the DMV. However, we have been told on more than one occasion that our space is more inviting than the DMV. So that's something. And I've also been known to tell people in the community when I'm doing trainings that if they're nervous about coming to our center, they can walk in the door. And if they don't feel comfortable, they can say, oh, I was looking for the DMV, and leave. So that allows people a little bit of an in that regards.
In the very beginning, now that I'm, trying to remember, we got involved with the trunk or treat, the Christmas parade. We had an open house. We got on our Facebook page. Beth and I did a podcast with somebody on Dear Al Stonington. We did radio, I think, ads, or I don't know if they're called ads, but like just little presentations just to get it out there. And we sent our calendar. We have a great calendar that one of our interns does every month. We made sure we sent that to everybody. And it worked. People started coming, and it's like more and more every month.
That's great. That's great. And Rob, a slightly different question for you. Having been in operation for 10 or 11 years now, are there any challenges to engagement after so many years? Or what do you do to sort of keep it fresh and to keep individuals engaged and to maybe engage the broader community?
Yeah, that's a great question. And a lot of what we do, is in line with what Tracy and Beth were talking about. We have to continue to create a welcoming, warm environment. People often say they feel like this is home when they walk in. But keeping in step with that is we have to listen to our community. A big part about keeping people engaged is that participatory process that I talked about. I need to make sure that we're keeping current with what people feel like they need and the direction they feel the center should go in also. So it really is, for me, it's about listening, listening to the people who walk through our doors. And making sure that we're employing strategies to bring new people in our doors. I think we're going to touch on it a little bit, but we oftentimes have trouble engaging with folks who are practicing harm reduction, and so we're exploring how can we create an environment and shift our milieu a little bit to make sure that they feel like this can be their place too. I think that's important, is kind of keeping a finger on the pulse of the community and what's going on out there, so that we continue to shift and kind of change and grow as our community grows and as our patrons grow.
Yeah, I really appreciate that responsiveness. So I want to ask you both to respond to a question that I get a lot. Some of my colleagues get a lot around a potential challenge that might come up in operating a recovery community center, and sort of related to your last comment, Rob, is how might you deal with an individual coming into that space who's in active use, knowing that the space is meant to be a safe space for folks in recovery? How do you deal with that? And Rob, if you don't mind going first.
Yeah, I get asked that question all the time too, when folks are exploring what they can do in their communities and at their centers. And, first I kind of touch on it policy wise, kind of the dry stuff. is we don't deny people access who are actively using. We ask that they be respectful, that they follow the rules. We make sure that, if they are under the influence when they come here, that they're not a danger to themselves or others, that there isn't a health risk posed. But we won't tell somebody you can't come here. Sometimes that's what it takes to get somebody through the door, to get over that fear and that nervousness. And we recognize that, and we also recognize, that when we're talking about recovery as a process of change, to move towards health and wellness, improved quality of life, that even if somebody's actively using, they might not be abstaining from use, but the fact that they've come in our door means that they're trying to engage in a process of change. And so that's why that's our policy, really, is that, as long as somebody's not breaking the rules, that they're not being disruptive or hostile, or they're not a threat to themselves or others, that we'll welcome them here. And a part of that, and I've stolen this from somebody, but I love it, is I've begun to be able to see that people are not cars to be fixed, right? They're gardens to be tended. And it's also better for me, in my self-care, if I'm not viewing it as trying to fix everybody, trying to get them where I think they need to be, but rather that I'm nurturing a relationship with them. And if somebody's not yet actively engaged really in their recovery, the fact that they came through the door means they're starting that process. And if I can nurture the relationship and, show empathy and relate with that person, then they're going to be more successful in their endeavors.
I really appreciate that, Rob. Really well put. And Beth and Tracy, I wonder, how do folks at the Inspire Center navigate that? Because again, each center is really unique and has a different approach and a different policy related to these types of things.
Yes. So first, I'm really glad that Bob went first, because we have reached out to Bob on more than one occasion to be like, what do you, kind of to get some advice, because yes, it is different. And the people that we see are different, and the environment that we're in is different, but also being able to share that information with each other and kind of bounce ideas, and see what's worked for a place that's been at this for significantly longer than we have is always really beneficial. And I think Bob kind of touched on this, that, we welcome people here at Inspire that are in all stages of recovery. And those stages include pre-contemplation, they include lapse and relapse, they include being in a place where you're stable and maybe can be an inspiration for other people. And I think something that's really important to note is that we've had people who have come in here who are still in active use that maybe have said, I had an individual say to me once, I may have to drink before I get here and when I get home, but for the 6-7 hours that I'm here, I don't. And I know that I'm not going to when I'm here. We've had another person who said, I may not feel like I'm ready for recovery yet, but being here at the center makes me want to do better. So, it's all bits and pieces that help someone to build their confidence and their desire. And sometimes people come in thinking that they can't do it, and what they need is a friend and a support to say, you can, and I will be there for you while you do it. So obviously, like Bob stated, we ask that people don't use here at our property. We ask that people continue to follow our center values while they're here and still be respectful. If there's an opportunity for someone maybe who is in active use and wants a one-on-one conversation, we want to be able to provide that avenue for people. If people are feeling triggered by the situation or a situation, we want them to feel welcome and invited to share that with us so that we can help talk them through that trigger, or just be there to hear them talk about their trigger. But also, we know that walking through that door is a huge step. We know that just showing up, for some people, that's all that they have to take at that moment towards recovery. And we want to praise that, and we want to encourage that, and we want to shout that from the mountaintops. And as someone speaking from, I do a lot of work in harm reduction here at our organization, is that I would rather someone be here and be safe with people who can call 911 or administer naloxone than for them to be somewhere all by themselves thinking, that nobody cares and what does it matter. But if they're here with us, they know I think that's something that's so special about every person that works here, and really most people that work in a field of recovery, is that we're here because we want to be here and because we care about the well-being of the people that we serve.
I always say, I love to plant the seeds and hope they'll grow.
Yeah, thank you so much for such wonderful responses, and I just really appreciate it, that at the core of those values are really, it's relationship based. It's about connection. It's about recognizing the intrinsic value of each human being that walks through your doors, and I really appreciate how well y'all encapsulate that. And I also want to lift up, in the peer community, I really appreciate seeing the sharing of policies, the sharing of experience, the going to one another for additional support and learnings. I see it a lot, and it's really, really great. So thank you for sharing an example of that as well. Back to something that Rob said that really sort of piques my curiosity, is that sometimes in this work, we have a tendency to sort of pigeonhole, silo, certain approaches or certain modalities. And another question that I'm asked a lot is, what's the intersection between harm reduction approaches and the work that happens at a recovery community center? And I'm wondering how y'all might answer. And Beth and Tracy, if you don't mind going first on this one, that'd be great.
And yours.
Yes. So harm reduction is a part of my other hat that I wear at Healthy Acadia. I do a lot of harm reduction outreach, and something that's really very important to me, because like you said, the individuals who we interact with, their lives are worth it all the time, every time. And I mentioned before, I would rather have someone who, obviously I'm not encouraging someone to come here and use or whatever, but I would rather they be here where they can be safe, and that there are people around who know what to do and how to react in those situations. So specifically here at Inspire, we offer naloxone training. We offer fentanyl test strips, and we also allow people to request those on our website so that it can be a very low barrier way for people to get those harm reduction materials. But, we kind of have touched on this a little bit. Everybody's path to recovery is different. And for some people, that includes lapse and relapse. For some people, that step, the only step that they can take is walking through the door. And our purpose as a recovery center is to provide services and a safe place for people. And that includes the people who are in active use. And as we know, with all of the substances that exist all over our state, all over the country, that comes with a pretty intense risk. And people can't recover if they're not alive. You can't move forward. You can't get to recovery. And I say this in all of my trainings that I do with folks. Every single person who uses substances is someone's mother, father, sister, brother, cousin, uncle, child, friend. whatever. And it's a ripple. It's like dropping a pebble into the water. You may not know it at first, but it impacts, no matter what, it impacts people. And I just think that it's so important for us to keep in mind that people who are using substances, their lives are worth living. And sometimes a recovery center or a staff at a recovery center, that might be the first and only time that they hear that and feel that. So it's really important for us to be able to enforce that for folks, because at the end of the day, it's the lives that matter, and it's the lives that change the world. So
That's great. Thank you. I really appreciate it. Bob, same question to you.
Yeah, as I mentioned before, I think especially recently, we're kind of drilling down a little deeper to understand that intersection of harm reduction and the recovery centers, and how we have more meaningful, relationships and venues for people to get involved who may not feel like they belong here. Right. And that's an important piece of it, I think, is, we're very fortunate here in the area. We have, in addition to, the barn, we do the things like Tracy and Beth mentioned. We offer naloxone training and distribution. We also, our recovery coaches anyway, have access to fentanyl test strips for when people feel they need those. And we have a recovery coach here who is a part of the Bangor Public Health Overdose Response Team. And he also works in tandem with the options program and the providers on the options program to make sure they're engaging with folks who are in active use, or maybe have, had overdose episode or event in their life, follow up with them and see what we can offer for supports. But, in addition to that, we're lucky we have a wonderful harm reduction organization in our area, the Health Equity Alliance, which, they address harm reduction, also a lot of kind of inequity and disparities in health amongst marginalized populations. So we're able often to give kind of a warm handoff to the harm reduction agency in our area. But yeah, I think it's important that we address, and this is why we're examining it more closely, is how do we make an environment where people feel they belong here? Because that's the thing I notice the most, is we are very accepting of if somebody is in active use and they want to access the center, but they don't always feel like it's their place. They don't always feel like they belong. So ongoing work with that and kind of looking at how we can do it. But I think that we definitely have made inroads in people understanding that you don't have to be abstaining, from substances in order to come here to access our services. I even push more recently what some people kind of would consider controversial, but I say harm reduction is recovery. It is recovery. If we think about the definition of recovery and moving towards wellness and quality of life, if you are using safely, if you've decided to buddy up, if you've decided to access clean use supplies and Narcan and naloxone to, prevent overdose episodes or come back from, then you're engaging in a better quality of life. You're moving towards wellness. So I say harm reduction is recovery. And we just really need to examine how we work together. And I'm doing that, with HEAL in this area. We've kind of been brainstorming about what are the best ways that we really kind of address that intersection.
Thank you so much. Really appreciate that last comment, that harm reduction really is recovery, right? I appreciate the work that you all do on that so diligently. And again, I heard a theme about that that it really, it comes back to that connection, that sense of belonging, that sense of acceptance, and that is really sort of a precursor to somebody potentially taking that next step, whatever it is for them, whatever might be right for them. And I think y'all and many of your colleagues in the field do a really wonderful job of it. Another question I'd like to ask, because the recovery field is sort of continuing to grow and evolve and develop, is what's new? What's new? Are any new initiatives, any new best practices, any new partnerships that you'd like to share? And why don't we start with Beth and Tracy, since they're already on?
Because we're so excited.
So we've recently gained the other half of our building, which gives us a lot more room. We're in the process now of painting it and getting it ready. So that's going to give us a lot more space to, allow for more partners to meet with people if they need to. It would give us, we could have 2 different types of meetings on a Wednesday night, or any night really, because there's something here almost every night. Gives us more space for that. We recently started Smart Recovery for teens and young adults. We would like to be able to have, possibly more offerings for teens, like meeting wise. We're always adding new programming, whether, someone calls us and said, I'd like to do this, or, like Tai Chi, they called us, wanted to offer that. All kinds of just different things. It just gives us more opportunity, more options to add more and more stuff that keeps, I always want to have a variety to appeal to, everyone, to have something that appeals to everyone.
And we're really excited about a lot of the space that is on the other side. We say the other side because we're the front half of the building, and the space that we've just obtained is on the back side of the building. Is we're going to have office space. So before we became a recovery center, our recovery programs were housed here. And unfortunately, some of those offices had to get shifted and moved around, and people lost storage space. And Tracy and I share an office that is really a closet. And as time has gone on, it has become more and more of a closet. So this allows us to have more coaching rooms on this side of the building. It allows us to have more space for people to interact, so that the office, the necessity stuff is out of the way, so that the recovery center stuff can be here and the focus.
Thank you. That's exciting news.
Hey, Mike, we do have 4 questions in the question and answer slot that I'd like to make sure you have time to take up.
Absolutely. Rob, very briefly, if you have anything new that you'd like to share with the audience, and then we'll look at those Q&As in the box.
Yeah, really briefly, I just would love to plug, because I'm very excited about, we are launching the Barn Recovery Justice Program here. We were able to secure some funding to increase capacity and have some staff that are going to focus very specifically on elevating our court diversion program, working with Maine pretrial and treatment courts, going out with law enforcement agencies and developing and practicing some tried and true deflection methods, and also for, bringing more impactful services and programs to the jails and institutions in the area. Anybody engaged in criminal justice, we really want to roll this out and be there for them.
Thanks for sharing that, Rob. That's a really important initiative. I'm really glad to hear that. So this first question in the Q&A is asking about your relationships with the general community in your areas due to stigma around SUD. And the not in my backyard concept that may be present. how has that been for you? What are relationships like in the broader community?
I think it's always a struggle. I think that I do think we're on like the verge of a place where people are understanding more and more what's happening, and that anyone can have substance use disorder. Like, you can't look at someone and know based on how they look, what they do, how they act, if they're using substances, because it can happen to anybody. We're all just like one side step away from being there, or from coming away from there. So I think that we're on the verge of people starting to see that. I think in every community there's resistance. And fortunately or unfortunately, I think the people who are stigmatizing of our space just stay away from it. And we don't see it a lot unless there's a situation that happens and then everybody makes the awful comments from behind their keyboard. But we've seen some really great support for our programming here. We had our Overdose Awareness Day installation that we made traveled to 2 area businesses. So we had Machias Savings Bank put our display up, and we put it up at the public library. We've had our police chief is always willing to be part of our events that we have here. I think we're getting there. There's still so much distance to go, because quite often stigma happens when you don't even realize it. But I think thankfully we haven't met a lot of resistance on that front in regards to that, I don't think.
And Rob, how about you in the greater Bangor area?
Yeah, hey, I think it's great that we're answering that question from a fairly new center. And then also, from our perspective of being established here, is because we have a really great relationship with both Bangor and Brewer. They don't tolerate us. They're proud to have us in their community. But that took a lot of hard work, and we still do see a little bit of NIMBY sometimes. But we try to get out there and help. One thing we do within our volunteer program is we'll take our volunteers and go and, we helped with a stream cleanup with the city of Brewer. And we've gone out and we've done things, some community building and some community beautification in Bangor with other organizations. We tell our volunteers, we expect the community to support recovery. It's one of our pillars. So in turn, when we get stabilized and ready, it's time for us to go into the greater community and not just live in this bubble, but to be a part of our community in general and to help them out and be a part of that. So that's helped us get where we are, I think.
That's great, Rob, because that spoke to a question I saw earlier in the comments about helping foster those relationships outside the 4 walls of the recovery center and in the broader community. So thank you for so tactfully answering 2 questions at once. I appreciate it. How are we doing on time?
You got about 5 minutes, Michael. And I'll take the 4th question, but you've got 2 more you can handle.
I saw one question about, how do you maintain a positive environment when you've got some folks coming into the space who may exhibit behaviors that make those relationships, fostering relationships a bit more challenging? How do you navigate that?
Snacks. Snacks and coffee. It seems to be it kind of levels the playing field. And I think laughter and fun, like we do have people who come in here who are resistant, but I think the fact that we're genuine with people, and we just, if they don't want to talk about what resources they need or what recovery thing they need, that doesn't mean that we're going to ignore them. We're still going to talk to them. We're still going to get them a snack. We're still going to welcome them in. And I think that helps, because it helps them to build trust in that they're not just a number that walks through our door. They walk in, they're our friends now, you know?
I heard someone say yesterday, like they love coming here. It's not rigid and it's fun and lighthearted. And, you know, I had another one tell me that, you know, even, you know, maybe he's not in recovery fully yet. I mean, he's made a lot of changes, but like he said, you guys don't push, you know, you let us know what there is, what, you know, what I can do, you know, but that makes me want to do better, but it's not because you guys are pushing anything on me, you know, like Bob said several times, we can't, we don't pick and choose what people need, you know, they need to do that.
That's great. Rob, anything to add?
Yeah, I mean, I just say, you know, I tell my staff all the time, first of all, it's not easy. I will say that it takes some patience to maintain a positive environment when you're dealing with behavioral issues or sometimes some toxic traits or relationship skills. But I tell my staff all the time, we have to allow people to make mistakes. You know, if there's a behavior issue, or if they've broken a rule, it doesn't always necessarily mean that we just go punitive. You know, there need to be learning opportunities. Folks in early recovery are trying to engage their recovery. They're going to make mistakes, and we're here to teach them, not punish them.
That's great. And briefly, if we can, there was a question about helping folks acquire documents that they might need, say for work, for housing, and other such things. And the question was, is that something that you help folks acquire?
That is a challenge, you know, sometimes. I mean, there's people that come in here that don't have $5 to get a second copy, you know, another copy of their ID, or they don't have an ID, a social security card, or a birth certificate, and you got to have one of those to get the other one,
Or
you
an
know?
address or a phone number to get an EBT card sent to.
So I mean, there's some ways of dealing with some of those things. Like there's been other agencies that can help with some of those, like maybe that $5 or that $15, or we provide them with, you know, the paperwork to do a lot of those things. I mean, it's always a challenge. You know, sometimes those things are a huge challenge, but we just try to give them the tools and the resource to do it and help them navigate through that. I mean, it's possible, but and that's what we do. We, you know, provide those resources.
And if DHS didn't know that we were a recovery center, they would probably wonder how in the world we fit so many people at this address, because whenever someone needs their main care or their EBT card and they don't have a permanent address, or maybe not a safe address to send stuff to, it comes to us. And that is a bright side of having the DMV right in the same parking lot. Is if someone needs an ID, they can go next door, take their tag, come back, have some coffee, and then go back in 20 minutes.
Well, I think we need to wrap up. Like that fourth question involved the issue of safe use sites, and that's not currently in our plan. Rhode Island just sent out their RFP for theirs. The federal law is still not clear, and the Biden administration has not it has it under review. I had an opportunity in 2019 to see the sites in Montreal, but I don't think any of us can predict really where that issue is going. As you know, there's the 2 sites in New York City. There's the site now that will be set up in Rhode Island, and we will certainly watch with interest what the evaluation and work going on in those sites, but it's not in our plan presently. I want to take this opportunity to thank Tracy and Beth and Bob and you, Michael, for doing this program. I thought it was great. I think that every center, and I'm so proud that there's 17, soon to be 21, has every center has its own, it has its own feel and its own culture. And just as every person has their own pathway to recovery, every recovery center has its own pathway to success. So let's leave it at that. Hope to see you all at the December webinar, and very thankful for all of you on that participate almost every month. And thanks so much, all of you, and enjoy this unseasonably warm weather this weekend. And thanks for all your great work. Have a great weekend.
Thank you all.